Brooke Jensen is a polysomnographic technologist, or plainly, the person who helps with sleep studies.
A sleep study is where we monitor your sleeping, your breathing, your heart rhythm, sleep disturbances, different things that would keep people awake, leg movements, basically just your overall sleep.
Jensen says people who are snoring or having trouble sleeping come to do sleep studies, and most of the time, she is searching for sleep apnea.
I'm able to assess if they have it, and it has to be a certain amount for me to assess that. If it's like a mild amount, the doctor would have to look at it. But also making sure their heart rate's okay. Obviously, if something were to go wrong with the patient, I'd have to come in and, intervene or something. And then also, making sure that they're sleeping okay, all those different things.
When people come for a sleep study, all they have to do is sleep. However, Jensen says that is easier said than done because of all the wires attached to the patient.
We start with leg wires, monitoring their leg movements, EKG that shows their heart rhythm, and then belts that show how they breathe. And then once we get more up to the head, there's a lot on the head that show how they sleep, if they have where they grind their teeth, or different eye movements, because that also shows REM sleep. We have a couple that sit under their nose that show if they breathe or not breathe. And then one on their finger for their oxygen saturations.
Jensen says to prepare for the sleep study, pack clothes to sleep in, shower to clean the hair for better readings, and for guys, groom your facial hair at least.
Men, sometimes we ask if they're a normal clean-shaven person just to shave, but lots of men like to have beard hair, so I just work around it if I have to.
The sleep study lasts around 10 hours, with the patient asleep at least for 6 hours for good results. If the first study comes back as sleep apnea, if they haven't been diagnosed already,
we will get them to the correct pressure if we're able to do that. And then after they leave, they'll get a home medical store that gives them their equipment, goes through all that, explains how it works. And then a couple months later, once they've trialed it, worked it through, the doctor will just make sure everything's working okay, that it's working for them.
Once they have a sleep apnea machine, Jensen says the patient will see near immediate sleep improvement.
I see a lot of men that come in because their wives tell them to. That's a huge thing. But usually because they're just tired of feeling tired, and they have this, makes them feel better. And then a lot of people swear by it. They wear it every night and they feel a lot better.